Today, we're diving into a topic that's been making headlines, but might not be on everyone's radar: Mpox, which you might know as monkeypox. This virus has been around for a while, but a significant outbreak in Africa recently concerned health experts. So what exactly is Mpox? It's a rare disease caused by the monkeypox virus, similar to the one that caused smallpox. The good news is that Mpox isn't as deadly as smallpox, but it can still cause some serious health issues. It was first discovered in monkeys back in the 1950s, hence the name, but the first human case was recorded in the Democratic Republic of Congo in the 1970s. Since then, there have been sporadic outbreaks, mostly in Central and West Africa, but nothing quite like what we see now. In this video, we will explain the current outbreak, why it's spreading so rapidly, and what it means for Africa and the rest of the world. This is a critical issue that deserves our attention, so let's get into it. What is Mpox? Mpox, which you might have known as monkeypox, is a zoonotic disease caused by the monkeypox virus, MPXV. This virus belongs to the orthopox virus genus, the same family as the smallpox virus, though Mpox is generally less severe and less contagious. Historically, Mpox was primarily found in Central and West Africa, where it remained relatively rare and contained for many years. However, recent outbreaks have spread the virus beyond these regions, raising concerns about its potential to become more widespread. How is Mpox transmitted? Mpox is transmitted through direct contact with an infected animal or person. This could happen by touching the blood, bodily fluids, or skin lesions of an infected animal, often rodents or primates, or by being in close contact with an infected person. The virus can also spread through respiratory droplets during prolonged face-to-face contact or through fomites, objects like bedding, clothing, or surfaces contaminated with the virus. Symptoms and disease progression. The symptoms of Mpox typically start with a fever, headache, muscle aches, and exhaustion. Swelling of the lymph nodes is a key feature distinguishing Mpox from similar diseases like smallpox. After these initial symptoms, a vesiculopustular rash usually appears, often starting on the face and spreading to other body parts, including the hands, feet, and genital area. The rash goes through different stages before eventually scabbing over and healing. In recent outbreaks, some patients have presented with unusual symptoms such as anogenital lesions, mucosal lesions, and other symptoms like anorectal pain and proctitis, which weren't commonly seen in earlier cases. Mpox versus smallpox. Although Mpox and smallpox share some similarities, such as the type of virus and the rash symptoms, there are key differences. Smallpox was far more contagious and often more deadly, with a higher fatality rate and severe complications. The good news is that Mpox, while serious, is less dangerous and less likely to cause large-scale outbreaks. Plus, we have vaccines and antiviral treatments that can help manage the disease, particularly in high-risk populations. Public health response to the Mpox outbreak. The Mpox outbreak has presented significant public health challenges, requiring a coordinated effort from African governments and international organizations. The response has focused on several key areas, each essential to containing the spread of the virus and mitigating its impact. Measures taken. African governments, alongside international bodies like the World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC, have implemented various measures to control the outbreak. These include enhanced surveillance to detect and monitor cases, rapid diagnostics to confirm infections, and clinical management protocols to treat those affected. In many regions, local public health units, LPHUs, have been instrumental in deploying targeted initiatives such as early diagnosis, contact tracing, and community engagement to curb the spread of the virus. Efforts have also been made to increase vaccine access, particularly for high-risk populations. The deployment of vaccines like Gineo's registered trademark and ACAM 2000 registered trademark has been a critical part of the strategy, despite initial challenges in distribution and availability. Additionally, treatments such as tecovirimat and cidofovir have been made available, especially for those at higher risk of severe disease. Challenges faced. Implementing these measures has not been without its challenges. One of the biggest obstacles has been the lack of resources, particularly in low-income regions with strained healthcare infrastructure. This has made it difficult to carry out widespread testing, vaccination, and treatment. Misinformation and stigma surrounding the disease have also posed significant barriers, complicating efforts to engage communities and ensure that people seek treatment promptly. Stigma and discrimination, particularly against groups most affected by the outbreak, have further hindered public health efforts. Role of vaccines and antiviral treatments. Vaccination has been a cornerstone of the response. Sexual health clinics and community health centers have been pivotal in delivering vaccines, especially to high-risk populations. The availability of antiviral treatments has also helped manage the disease, reducing the severity of symptoms and the duration of illness in many cases. Importance of public awareness and education. A critical aspect of controlling the Mpox outbreak has been increasing public awareness and education. There is a significant gap in knowledge about the virus, its transmission, and how to prevent it. Public health campaigns have aimed to close this gap, emphasizing the importance of early detection, safe practices, and vaccination. Effective communication is key, not only to educating the public, but also to reducing fear and anxiety, which can lead to harmful behaviors or reluctance to seek help. Global implications and lessons. Learned from the Mpox outbreak. The recent Mpox outbreak has had significant global implications, underscoring the interconnectedness of our world and the importance of robust public health systems. Originally confined to certain regions in Africa, Mpox has now spread to over 110 countries, including many non-endemic areas like Europe and North America. This global spread led the World Health Organization, WHO, to declare Mpox a public health emergency of international concern in 2022. Potential for global spread and response. The rapid spread of Mpox beyond Africa has shown that the virus can easily cross borders, especially through international travel. While the initial outbreaks were largely contained within Africa, the disease quickly spread to other continents, facilitated by the global airline network. This situation highlighted the limitations of travel restrictions in preventing the spread of infectious diseases. The response to this outbreak has involved local health systems and international cooperation, with global health organizations providing guidance, resources, and support to affected countries. Lessons learned in preparedness. One of the key lessons from this outbreak is the importance of being prepared for the unexpected. The global spread of Mpox has emphasized the need for strong public health systems that can rapidly respond to emerging infectious diseases. This includes having effective surveillance systems, rapid diagnostic capabilities, and the capacity for clinical management. The outbreak also brought attention to the need for intersectoral collaboration across different sectors of society and government to coordinate a comprehensive response. Another critical lesson is the importance of addressing stigma and discrimination. The outbreak predominantly affected men who have sex with men, leading to social stigmatization and, in some cases, hindering public health efforts. Ensuring that health interventions are inclusive and equitable, with no one being left behind due to stigma, is essential for controlling infectious diseases. The role of international cooperation. Managing infectious diseases like Mpox requires international cooperation. No single country can effectively tackle such outbreaks alone, especially when the disease spreads across borders. The Mpox outbreak has shown that global health threats need a coordinated response that includes sharing information, resources, and strategies. International collaboration has also been vital in addressing the challenges of vaccine distribution and ensuring that treatments are available to those who need them most. Importance of public awareness and education. Public awareness and education have proven vital in controlling the spread of Mpox. However, the outbreak has revealed gaps in public knowledge, highlighting the need for targeted education programs to improve understanding of the disease. These programs are crucial not only for informing people about how the virus spreads and how to protect themselves, but also for reducing misinformation and alleviating public fears. Overcoming vaccine hesitancy, particularly among healthcare professionals, and educating the public about the importance of vaccination have been ongoing challenges. Thanks for watching. Alright, that's a wrap on today's video. We've covered a lot of ground, from understanding Mpox and how it spreads to the global response and the important lessons we've learned. This outbreak has shown us how interconnected our world is, and how critical preparedness and international cooperation are in tackling public health challenges. Now I want to hear from you. What are your thoughts on the Mpox outbreak? Do you think we're doing enough to prevent future outbreaks? Drop your comments below. I'm curious to see your thoughts. If you find this video helpful, give it a thumbs up and don't forget to subscribe to the channel. By subscribing, you'll stay up to date with our latest content on global health and other important topics. Also, if you know someone who might find this information valuable, please share the video with them. Thanks so much for watching. Stay tuned for more videos where we explore other pressing global health issues. See you next time!